Hey folks, we're back. I'm your host, BKP, and we're at Sycamore Crossing this morning in downtown Blue Ridge. I'm here with Dr. William Whaley. This time for Ask the Doc. Thank you, Georgia Cancer Research Specialist affiliate at Northside Hospital. Give me that a really big statistic that came out for the Northside Hospital as far as the cancer.
Okay, we're the number 2 community cancer center in America. And we're the 5th largest cancer center in America. And the number 1 bone marrow transplant survival service.
I just
complicated, right?
No, I like to get that out there because that is big, that's important, and it is now time. How are you doing?
Well, I'm doing good. You know, usually we start off with some thing out of the news before we get to the questions. So my only thing about the news is if you look at your watch, we're a little bit late because BKP was doing baseball and left the wire at the baseball diamond, and so you could have gone all day without saying that, right?
No, you could say that we forgot to bring an audio cable this morning. We're 2 minutes late, but you're not shocking anybody to tell them I was somewhere watching baseball.
No, I'm not shocking. No.
Right, John?
All right.
So
you better get to them because we have to stuff.
There you go.
Well, since you left the glasses out there.
You had to tell that too.
Oh, yeah, maybe might have left the glasses out there. All right. First question we got this morning was really kind of an interesting question. I had arguments with somebody in my house about the question, so I'm gonna read it real slow. Is it true that hormones now put into the chicken and other meats can speed up the growth and development of our children? Could this also increase cancer or chances of our kids developing cancer because of the stuff they are using to boost growth in the meat?
I'm interested in that because I just say, it might be me, but I just say, my gosh, these kids in high school, I mean, is that the result today of McDonald's? Because I mean, I don't know. I just didn't think, and we have this discussion, and I might be going down the same road as somebody in your house, but we have this discussion with a lot of friends, like, kids didn't seem big and as athletic.
All right, that's exactly true, but I've told you this before. When I was a child, when you were a child, we had ear infections before penicillin. We had measles, mumps, chicken pox. We had all of these childhood diseases. Anytime you have a fever, you stop growing. So if you take the standard list of 7 childhood diseases, which lasts 2 weeks, that's 14 weeks. You take 3 or 4 bouts of tonsillitis or ear infections that last 2 weeks. You're up to 10 or 12 episodes of significant infection that occurs during your childhood, 2 weeks in length. That's 6 months. So you have got 6 months more growth now that we didn't have, purely because of the lack of childhood illnesses and fever. And second, you have much better nutrition than we had in our day, and it's not the hormones. So let's get on with that. I'm going to show you. This is exactly show those chickens. Now, that's what you're saying the kids in high school look like, right?
Yeah.
Is that the kids in high school? Now, that's a great picture there, isn't it? Look at that thing. That shows you the difference in size of a commercial chicken at a standard, I forgot what that's, 12, 16 weeks, between 1957 and 2005. So you could pull that thing down. Now, everybody is blaming that blaming the fact that this is true on the fact that our kids are getting bigger, and there are some people that say that those hormones are coming into our children and are causing them to have adverse fertility effects or whatever. And I hope that by the time I get through this, you will understand that particular group of people are the same ones who say you shouldn't get immunized and LBJ killed JFK and we didn't land on the moon. Now, the next one, show the cow. That's a cow. And if you stop and look at that stuff, you think this is, most time you see this, that this is a sirloin steak and that's a roast. But if you look at all the rest of this, everything from chewing gum down here to candles and detergents and perfume is made out of the fat of cattle. Skin goes into gelatin and sheetrock and adhesives. The bones make sugar, charcoal, and fertilizer. The blood makes imitation eggs and cakes. And so in spite of just the fact that you're concerned about cattle and their meat and what is done with the hormones, you would ask the question, does any of that stuff that's then used to make all the rest of these things that we eat affect our children's health or our health? Go on to the next one here, because this is exactly like the graph you would see of people who are concerned about taking immunizations. This says, what percentage of people, I mean, people aren't be able to read it, but what percentage of people believe that organic fruits and vegetables are better for health?
55%.
All right. What's the percentage of people that believe that genetically modified foods are worse for your health?
39%.
All right. So, and then this is about how many people really care. Okay, so pull that thing down now. We'll talk a few minutes. So, there, as I've said once before, there is really no significant health benefit from a food that is said to be organic, because the label of organic has got so many holes in it that it can have less in the way of having had insecticides and stuff applied to it, but in terms of nutritional value, it's not any better at all. Now, the thing about genetically modified food is, we'll go back to those chickens. You remember when we were kids, tomatoes were this big around, right? Mm-hmm. And then they had the big boy, and then they had something else. Well, basically, genetic modification is choosing a better product, or taking a product and then modifying it so that it's not susceptible to various insects and pests and fungi and so forth. But the actual nutritional value of the food itself is equal to whatever you used to grow back in the 1940s. You got that?
I'm staying with you.
You don't. So.
When you go to fruits and vegetables, I have to tell you, hormonal. We're talking about the
GMO is
right.
Fruits and vegetables.
Okay, but I'm thinking about the taste, and I'll tell you why. It seems like I can get a nice little fresh strawberry, and it just explodes with taste. And I can go to the grocery store, and they try to bring me in with these strawberries that have been grown this big, and they seem not to have taste.
Now,
I didn't mean to get sidetracked, but when you were going with that, I'm thinking fruits and vegetables, same thing with a...
Well, you got a member of the expert panel who is the first person that I've ever seen when they get, this apple doesn't have any taste, or this strawberry doesn't have any taste. And so I am not going to get into taste, because
okay, I didn't mean to do that.
Taste is like the eye of the beholder in art, correct?
Yes.
So I can't tell you about your taste or my taste. All I can tell you about is the nutritional value,
all right,
or harm of the hunk of food, okay? So we're sticking clearly to things that can be measured, because when you say this barbecue from that place tastes better than that place, that's why they make chocolate, vanilla, and strawberry, because people have different tastes. All right, well, let's go to the next one over there. Now, the percentage of people who believe that antibiotics in meat and pesticides in produce produce a health risk. It's a pretty big number. That's over a third for every single solitary product. People won't be able to read it, but first one's meat, second one's fruit, the next one's drinks with artificial preservatives, last one's food or drinks with artificial coloring. So it's touching on everything that the anti-immunization crowd will have. This next, the first chart, Josh, I think this is going to blow your mind. So we have here a piece of beef from a steer that was given hormones. There was a red bug here, so we're going to have chiggers waking up in Blue Ridge. Now, the amount of estrogen in a hamburger of a beef, a piece of beef that's had hormones given to it to help it grow is what's the number?
2.
What's the number of the amount of estrogen in a bottle of beer?
15.
What's the amount of hormone in a portion of raw peas?
500.
What's the amount of estrogen in a cabbage?
2976.
Almost 3,000. All right, a birth control pill.
35,000.
35,000. So somebody who's worried about the estrogens in meat that eats peas, cabbage, or takes a birth control pill is, I mean, what's the order of magnitude here? It's crazy, isn't it? Now, this is the amount of estrogen. The estrogen in a man, every day, he produces 100,000 nanograms of estrogen. A woman, 5 million nanograms of estrogen, and a pregnant woman, 90 million nanograms of estrogen. So, there's no way that 2 nanograms of estrogen in a hamburger is going to affect in any way the amount of estrogen that those people get, right?
Okay.
Or beer, peas, or cabbage. So now we're going to go over here to a few other little things. All right. Now, any little kid, a female child, before they begin to have any sort of sexual growth and development, is putting out 54,000 nanograms. Remember, there's 2 over here in the beef.
Right.
Boy is putting out 41,000. And then as they go into adolescence, that number goes up like crazy, right? Now, many of the people that are here on your expert panel that are conservative tell you that you're better off with olive oil and stuff than you are with something else. When you start looking at the things that they are looking at to be healthy, like soy burgers and soy milk, soybean oil, 168,000 in a portion of soybean milk or soy, what do you call it? Vegetarian vegetarian burgers. You got it?
Burger, yeah.
All right, so everything else in there, they're loaded with estrogen, everything naturally, and the amount that's going to show up in your beef is essentially zip. Does that help you?
Yeah, that helps me.
You sure?
Well, yeah, it helps me because you bring a lot of facts, and I'm not. I agree with you.
Praise the Lord.
You bring a lot of facts.
Praise the Lord. That is the problem with the anti-immunization, the beef that's got too many hormones in it, is you can't confuse these people with facts.
Okay,
and that is exactly what the scientific community says.
Yeah,
There's no sense in presenting the facts because they aren't going to listen, and they're going to go on YouTube and find some guy who was fired from the CDC that says that this stuff's all true, and then they're going to believe it.
Okay, wait a minute. You bring a lot of facts, but there was a but coming, and you didn't give me my. All right, now wait a minute. You bring a lot of facts.
Oh, I have a heart attack.
But okay, we live in an area that there's a lot of chicken farmers, and I'm not going to mention the companies that sponsor these chicken farmers, whatever their agreement is. But these companies, you showed the 3 chickens.
Yeah.
Okay. Well, these companies have gone in because I've got friends in surrounding counties that have multiple chicken houses, and they've gone in and they figured out delivery. I mean, they got it down to a science. They got delivery, how many, they go in the house, they got to come back out. They got to get so many flocks a year for
at a certain weight.
At a certain weight, everything like that. So I'm thinking, instead of the chicken just hatching and roaming around in the backyard until you feel it's time to eat said chicken, I feel the other way, something about that just cannot be good for us. That's just, you bring the fact that there's something about that just seems, something about that just doesn't seem like it would be good for us.
All right, I'm
not arguing.
Whoa, I'm going to agree with you. I'm going to agree with you. But there's something about that that's not good for you, is that when you took that chicken out of the yard,
Yeah.
you remember your grandmother, she went out and grabbed that chicken and either slung it around her head,
Wring it neck.
popped it like that, and the chicken ran around in the yard, or they whipped it over a stump and chucked the head off.
Absolutely.
Then
Sunday
they took
dinner.
They took it
Preacher on the way.
They took it in the house and they cleaned it.
Yes.
Okay, what's not good is 100,000 chickens in those 10 trucks that end up in LJ down there that get hung on that line get contaminated with the poop from the other 999,000 chickens, and then at the very end of the line they get washed in Clorox.
Yes.
And so what's happening to those chickens isn't the fact that they're bigger to start with. It's what happens to them once they get them and take them down there to process them. So if you had that chicken in your own yard there and you threw him some of that good feed and then you wrung his neck and cleaned him the way you wanted to clean him, I think you would eliminate all of the foodborne disease that people were talking about, and the piece of meat that you have is equal to the piece of meat you would have had when that chicken was scrawny, and there's no, and the taste, I can't get into the taste. I'll have to leave the taste to you.
I want to make sure you know I'm not arguing the facts, but I'm, just something don't seem right with them.
I'm not arguing that point with you, but to me it's the process.
So them super chickens that they got today. Okay,
all right.
We probably should move along.
Okay, now this next question is this next question has been sent in by it's not a question. Put the scenario up there. This is a scenario. I'm going to read the whole scenario because it does not ask a question.
Right.
And it does not give you the sex or the age.
Right.
And it does not give you the chronology of the story. But the story is, first of all, I have had 4 back surgeries. That right there is terribly unusual. There's not many situations where you would have 4 back surgeries. I have permanent nerve damage in my left leg. That is called the failed back syndrome, and it has a name. This started about 6 months ago, and every now and then I would be awakened in the middle of the night with severe pain in both knees. It felt like they would blow up, and it seems like it is in the front of the joint in both legs. I've never had pain in my right leg, and I found that if I wrapped both knees as tight as I could, it would help. But I would have swelling above and below the wrap. Let me stop right there. If you take a normal limb and you put an elastic wrap on it, it's going to swell above the wrap and it's going to swell below the wrap because of the change in the way the lymphatic fluid goes, and that means that the wrap is doing its job and holding the joint tightly. So that's not, unless it's so tight you don't have a circulation. All right. Now, in the last 3 months, the pain is about every night. So this is really terribly affecting the quality of life of the person who sent this in. 4 back surgeries, permanent nerve damage in my leg. Every night I'm having pain. Now here's the crucial part. This pain is no longer helped by wrapping, ice packs, or heating pad, meaning the conservative therapies. I'm already on Percocet, narcotic, Robaxin, muscle relaxant, Klonopin, that's benzodiazepine like Valium or Xanax and those drugs. You don't know these other 2, Oxtella and Zonisamine, are both anti-seizure medicines, epilepsy medicines, that are given to people with peripheral neuropathy or chronic pain, generally only in a very specialized pain clinic run by anesthesiologists, okay? All of which are for my legs. Well, they're for everything. The pain is sometimes so bad that it radiates up into my thigh, and usually the pain is worse on the right side. Now that's a big scenario. And then as an afterthought, one other thing. I don't know if it's important, but I have peripheral neuropathy. So here you've got one, what we call the failed back syndrome. Two, you've got what is probably spinal, that's the paralyzed leg, or the permanent nerve damage. Then you've got, let's go to this, you've been through this a few weeks ago. You remember that?
Yes.
All right, so what we're showing here first is the anatomy of the back. 4 operations on the back. I can't imagine any constellation of situations where that would be common. I'm not demeaning any sort of treatment. I know nothing about the patient. We're giving no history whether those 4 back surgeries are closed over 20 years, and we're talking about an ex-rodeo rider who
right.
Fell
that's
off,
what I was getting ready to say.
Who fell off
somebody
a horse,
experienced a bad car wreck.
Yeah, car wreck or whatever.
Right, exactly.
Yeah, so we've got lots of situations that could explain 4 back surgeries. But anyway, 4 back surgeries, they're gonna have been some stabilization of this. Remember we talked about this spondylolysis and stabilization there, but the fact that there's permanent nerve damage in the leg tells you that where these nerves are coming out over here, there was a structural abnormality, and I'm interpreting this to mean that nerve damage came from the surgery, not that it was present there and the surgery did not relieve it. Okay? And there's the train bell.
There it is.
All right. Okay. So put that question right back up again, and we're going to go to the next part here. When you get down to what they're doing about it, so we had 4 previous surgeries, paralyzed leg. There's nothing that can be done about that to correct it. In my opinion, the failed back, don't take a 5th surgery. So you can't fix that. Now, you're talking about the first thing on the list is I'm taking Percocet. Go up to that ladder. Here's the ladder about the relief of pain. You start on the first step. And on the first step, you're talking about non-steroidal anti-inflammatories, aspirin and Tylenol type drugs. And you do not graduate to the next step until your physical therapy, your massage, your heat, your everything else, and this first level of pain medication has been exhausted. When you go up to the second step, you go up to the sort of non-big boy drugs. Codeine is a non-big boy drug. Tramadol is a non-big boy drug. We used to have one called Darvon. So you have the non-opioid second level. Now, when you get to that point, you might you're talking about consideration of the hazard-benefit ratio. When somebody's complaining of pain, it's a lot like BKP talking about the taste of a strawberry. I can't measure your taste of a strawberry. Well, there is no way to measure pain. And you have people who complain of pain and tell you I'm about to die of pain, when with the exact amount of pathology, somebody else may be at work. You understand what I'm saying?
Yeah, let me ask you, not to interrupt you, but when you brought that up,
I want you to interrupt.
No, I was thinking about pain the entire time, because you can only, if I'm sitting in your office on pain, you basically can only go on what I tell you.
That's 100% right.
What I tell you, and give me the reason why you would be, and other doctors, the first thing you say on a scale of 1 to 10.
Yeah, we give you that
What
scale.
is that?
Well,
I mean, how did you guys? When I say you guys, how did you develop that scale?
Okay.
And how is it useful in pulling out what you need to know?
Okay, that's a great question. That's called a visual analog scale. And 0 is normal. And you have to imagine, so you usually would say 10 is childbirth without anesthesia, or passing the kidney stone. You're trying to find something, a man or a woman, or a fractured bone that's sticking through the skin. So that's the worst pain you can think of. 0's, and then most people can equilibrate to that. Then we know that the sprained ankle without the fracture generally is a 7. We know that the rib fracture, if you don't move, it's a 4, but if you take a deep breath and spin, it's an 8. So some of the things that happen frequently, or dental surgery, we know how. So we can take that visual analog scale and we can then apply it to things that have been measured. And take 1,000 people have a tooth pulled, and 800 of them say it's a 6. Well, that's a 6. You got that?
Let me ask you this, one more thing on pain. There's a difference in having pain as a result of something you've done and then living in pain.
Correct. That's where we're going next. Okay, pull down that.
I got this one.
Pull down the ladder. Living in pain. This is a chronic issue here.
Right. I know people that live in constant
all right. Well, you're sitting with one. You got a bad back, and I'm in pain all the time. Now, this is the CDC. My wife is just not a very good CDC fan. The CDC checklist for prescribing opioids in chronic pain. The deal is you really don't want to begin using the top-level narcotic for something that's going to be there forever, because the hazard-benefit ratio of a narcotic drug, constipation, driving your car off the highway and stuff, that's a big hazard. Now, is the benefit, how much pain are they really having? So we're not going to try and look at this, but first thing in, when considering a long-term opioid therapy, the very first thing at the top is, I know you can't see
set realistic
goals. So the issue is, this lady with the nerve damage and the chronic 4 failed backs, the realistic goal is not that she's ever going to be pain-free.
Right.
The realistic goal is how to get pain to the point where she can function and work and bag groceries or whatever she wants to do. And then there's a lot of responsibility about when to reassess and when to rethink what you are doing. All right, so I'm going to say with this question that the person who, not question, but statement, that this person is taking every category of drug except a non-steroidal. There's a narcotic, muscle relaxant, a Valium-like sedative, and then anti-epilepsy drugs. You see the ads on TV for peripheral neuropathy. That's what those two things are for. And it's still miserable. So that patient needs to be in the hands of a university pain clinic, a pain clinic like is associated with Emory or Piedmont or Northside, or that is run by anesthesiologists who know how to do nerve root injections, epidural steroids, and to use medication. So I would tell that patient right there, if you're having a lot of trouble, someplace you need a good pain clinic. The last part of it is the peripheral neuropathy question. And you will have, let's go to the last little question there. You remember that we went through this thing with the peripheral neuropathy not long ago. And the symptoms of peripheral neuropathy can be nothing more than the tip of my finger. You can pull that down, Josh. The tip of my finger is a little bit numb. Remember I asked if you could button your collar?
Right.
If you could zip up your pants, or you could thread a needle in cancer therapy. We get about that much peripheral neuropathy. Or that TV ad where they show that guy walking on the glass. Well, I think the peripheral neuropathy is where those last two drugs are coming in, and that also should be in the hands of a pain person. So that question did not give us, number one, it didn't ask a question. It gave us a scenario. 2, it didn't give us why there were 4 back surgeries. And it did not tell us whether these drugs have been prescribed by a high-quality pain clinic, or there are a variety of medications coming from an orthopedist who did the back and from a family practitioner or whatever. So my advice to the patient is, if you're already in the hands of a pain clinic and are dissatisfied with your outcome, which is what that sounds like, find the closest university type or high quality medical institution with a pain service and go there.
Well, that was great information. It answered a lot of questions for me. It really answered a lot of questions for me. And if you have a question for Dr. Whaley, you can send it to info have him ask the question to Dr. Whaley, info@fetyournews.com, and put in the subject line of your email, ask the doc. As Dr. Whaley said, it's helpful for him to answer the question if he knows your age, male, female, or what took place that caused these surgeries. It is a great example. So the more detail you can give the doctor, the better answer he could drill down to the answer,
right,
more specific. So again, info@fetyournews.com, and put Ask the Doc in the subject line. Also, we do go through our social media, fetyournews.com, FYNTV, and if you see on Facebook or Instagram or anywhere out there an Ask the Doc question and you put something on there, we do go through there and look for those also. We want to thank Georgia Cancer Research Center and affiliated with Northside Hospital for this segment. We appreciate them bringing this to you every week. Okay, so what's out there in the medical world that we need to know today?
All right, well, we're not going to talk about Martin Luther King's peccadillos. I want the expert panel to listen. I want the expert panel to listen carefully. The last 5 years, or ever how many years we've been doing this, people have talked about exercise, and I've been saying exercise, 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 and everybody that I know just about has one of these watches.
Yes,
and there have been so many statements. I need to get 10,000 steps a day. I'm going to try and give a very reasoned explanation of a study that just came out yesterday that says exercise is important and you can probably get away with less if you are the type of person who doesn't want to get the 10,000 steps a day. Now, the 10,000 steps a day might help you more with weight control or fitness, but health only. This study is 17,000. Expert panel, listen now. Expert panel, listen. This is 17,000 older women. The average age was 72. The study was of 5 years duration. Listen to this carefully. If one of those people got 4,400 steps a day, that's below half of the 10,000. They lowered their chance of all-cause mortality by 41%. That's not just heart and stroke, that's all-cause mortality. So that means that they're more fit, they don't fall down and break their hip quite as much or whatever. All-cause mortality, 4,400 steps. Now, if you got up above 7,000 steps, you got a little additional benefit. You went up to 58. That's only 14% more. So those people that say, well, I can't get 10,000 steps, so I'm not going to do it at all, can go and try and get the 5,000 steps roughly and have the biggest benefit. And this is particularly people of 70 years old and older. So I'm trying to encourage the group of people that got those watches that are 70 years old or older to try and get in the range of 4,500 to 5,000 steps. You like that one? I got one more quick one.
Go ahead. I don't need to count my steps. I don't count.
You got plenty. All right.
I don't count
now,
my steps.
We've been selling vaping. We've been telling people, look, it's a lot safer to vape than it is to smoke 3 packs of cigarettes a day, and the vaping's not for kids. There is some evidence that the cinnamon and the menthol and so forth that is in the vape materials does have some adverse effects on arterial pliability, but that's a tiny thing, whereas the benefits of taking the smoke out of your lungs is a huge thing. And I don't want people that are using vaping to stop a bad cigarette smoking habit to take that. It's going to be in the news today. Oh my goodness, I need to stop vaping, go back to cigarettes, because it does not tell you in that report what the order of magnitude is. The order of magnitude of this damage is way down here and the benefit's way up there. So we're like everything else we've done today. It's got to be a consideration of the hazard, benefit, and there's the beer truck.
Oh, he doesn't know.
Well, it's a truck. The hazard benefit ratio of what you're doing here. Is that enough?
Yeah, I was fine until you said beer truck, and I look around. I mean, you know.
Was that a beer truck
It's
or
like,
was that a
it's
moving?
like saying squirrel, all right? No, it's one of the delivery trucks. I don't know what time they changed that delivery from last year, but it was about now that we started getting our beer delivery.
And you notice today we got the train bell. It's the second time and not the
Yes,
whistle.
we're getting the train bell down here in Blue Ridge. Well, Dr. Whaley, I appreciate you very much. I mean, I think I could really go into a lot more on asking questions about pain. There's a lot of different things that you can talk
It's like
about.
the taste of the small strawberries.
Yeah, well, if you want to go into taste, we will. No, I don't want to go into taste. I go
It's
to the
subjective.
store. I don't want to name the stores because they're good people, but I get like an apple and it has no taste at all. I'm like,
You're right.
right.
Well, I was saying that to,
And then I could go down here to Monsieur's Orchard, and I could get an apple, and oh my gosh,
wonderful.
right?
wonderful, yes.
We don't need to go there.
Well, we did go there because I said I never had anybody say anything about this has no taste until the member of your expert panel began to tell me that years ago, and I don't see it. It is totally in the eyes of the beholder. Well, he did. He was talking about the small strawberry and
I
the
got a
apple.
small strawberry over here at Monsieur's. It just explodes with flavor, and I go to certain stores and they sell me. They got these pretty
Big
things.
GMO strawberries.
Yes, and there's no taste in them. No, they don't. They do not pop in my cereal. Let's go.
That's correct,
Hey.
but they have the same nutritional value, not the same
Oh,
taste.
gosh. Ask the doc. See, this is what happens. Hey, we want to thank Dr. William Whaley every Friday. And don't forget, all of our segments are on our YouTube channel, Fetch Your News FYN TV YouTube channel. There's a playlist that says Ask the Doc. We have so many different questions over the years that if you want to research and look at many other medical issues that Dr. Whaley has covered, it's on that playlist. And you can also send your question to info@fetchyournews.com. Put Ask the Doc in the subject line. Again, thank you, Georgia Cancer Research Specialist, affiliated with Northside Hospital, for this segment. We'll be right back with the All-Star Political Panel. And we got a little extra Jane and a little extra Bruce coming your way, right? Rick is out gallivanting. So we'll be back after these messages.